Welcome to our in-depth look at double orifice mitral valve, a rare congenital heart defect. Join us as we explore its causes, effects, diagnosis, and management strategies, offering a comprehensive understanding of this unique cardiac condition. The exact cause of double orifice mitral valve, or DOMV, remains largely unknown. It's a congenital anomaly, meaning it's present at birth. Current understanding suggests that DOMV arises from errors during the early stages of heart development in the womb. Genetic factors and environmental influences may play a role, but definitive links are still being investigated. It's important to note that DOMV is not typically associated with specific genetic syndromes. The mitral valve, normally a single opening between the left atrium and left ventricle, is divided into two distinct orifices in DOMV. This structural abnormality alters blood flow through the heart. Depending on the size and function of each orifice, the individual may experience varying degrees of mitral valve stenosis, where the valve doesn't open fully, obstructing blood flow, or mitral regurgitation, where blood leaks backward into the left atrium. These abnormal blood flow patterns increase the workload on the heart, potentially leading to heart enlargement and eventually heart failure if left untreated. Double orifice mitral valve is a very rare heart defect. Exact epidemiological data is scarce, but studies suggest it accounts for a small fraction of all congenital heart defects. It's found worldwide and affects both males and females equally. Due to its rarity, it often goes undiagnosed or misdiagnosed, which contributes to the difficulty in obtaining precise prevalence figures. The symptoms of double orifice mitral valve can vary widely, depending on the severity of the defect. Some individuals with mild DOMV may be asymptomatic for many years. However, as the condition progresses, symptoms may emerge. These can include shortness of breath, especially during exercise, fatigue, palpitations, swelling in the ankles and feet, and chest pain. In infants and young children, symptoms can include poor feeding, failure to thrive, and rapid breathing. Diagnosing double orifice mitral valve typically involves a combination of clinical evaluation and imaging studies. A physical exam, including listening to the heart with a stethoscope, may reveal a heart murmur indicative of the abnormal valve. An echocardiogram, using sound waves to create images of the heart, is the primary diagnostic tool. It allows visualization of the two mitral valve orifices and assessment of their function. In some cases, a transesophageal echocardiogram, which provides a clearer image from inside the esophagus, or cardiac MRI may be necessary for a more detailed evaluation. Double orifice mitral valve can be classified based on the specific anatomical configuration of the two orifices and the connecting tissue, known as the bridge. Some classifications focus on the size and symmetry of the orifices, as well as the presence or absence of significant stenosis or regurgitation. Descriptions like dominant orifice or symmetric orifices help categorize the specific presentation of DOMV in each individual. These classifications guide treatment decisions. The management of double orifice mitral valve depends on the severity of symptoms and the degree of valve dysfunction. For asymptomatic individuals with mild DOM, regular monitoring with echocardiograms may be sufficient. For those experiencing significant symptoms, medical management may include medications to control heart failure symptoms, such as diuretics and ACE inhibitors. In more severe cases, surgical intervention may be necessary. Surgical options include mitral valve repair, aiming to correct the defect and restore normal valve function. Mitral valve replacement, where the diseased valve is replaced with a mechanical or biological valve, may be considered if repair is not feasible. As double orifice mitral valve is a congenital heart defect, there are no known preventative measures. Prenatal care, including avoiding exposure to harmful substances during pregnancy, is generally recommended to promote healthy fetal development. Genetic counseling may be considered for families with a history of congenital heart defects, although the specific genetic causes of DOMV are not yet well defined. The prognosis for individuals with double orifice mitral valve varies depending on the severity of the defect and the effectiveness of treatment. Early diagnosis and appropriate management can significantly improve the long-term outlook. Recent research focuses on refining surgical techniques for mitral valve repair in DOMV and developing less invasive approaches. Furthermore, studies are investigating the genetic basis of congenital heart defects, including DOMV, which may lead to better understanding and potential preventative strategies in the future. Continuous advancements in cardiac imaging and surgical techniques offer hope for improved outcomes for individuals living with this rare condition.